cough into your sleeve. Should I wear a mask? Wash your hands. The coronavirus, or COVID-19, is affecting our daily lives. We'll dig through the data and answer your questions tonight on Call with the Prairie Doc. Good evening and welcome to On Call with the Prairie Doc. I'm Dr. Andrew Ellsworth, one of the Prairie Docs. Because of the current events due to the COVID-19 pandemic, we are bringing you a special edition on that very serious topic. We answer your questions about the coronavirus or COVID-19 as they are called in to us and sent to us via Facebook or email. Call in questions to 1-888-376-6225 or send us an email to the address on the screen. Joining us from Sioux Falls via Skype is Dr. Jawad Nazir with Avera Medical Group Infectious Disease Specialist in Sioux Falls, South Dakota, and Dr. Kelly Evans with Avera Medical Group Brookings. Welcome, Dr. Nazir, Dr. Evans.
Thank you.
Happy to be here.
So, the coronavirus, COVID-19, Kelly, what are some of the symptoms of this?
Well, part of the difficulty with this particular disease is that symptoms can mimic other very similar respiratory illnesses. So common symptoms might be fever, cough, and other respiratory symptoms. Shortness of breath might signal a little more severe case of the disease. And in the worst case scenario, or when people get severe illness, they get respiratory failure from something called acute respiratory distress syndrome, which can require mechanical ventilation and some of the things that most people have probably heard and read about.
Jawad, you're an infectious disease specialist, and I understand you're heading up Avera's efforts in dealing with this. What are you seeing from coronavirus patients?
Yeah, so I think, I agree with Dr. Evans, the common symptoms are fever, cough, shortness of breath, based on the data from the Chinese studies and recently from the MMWR article published in regarding the clinical characteristics of patients in USA. Sometimes there could be some additional symptoms, not, very commonly, but rarely, such as diarrhea, myalgias, confusion. So it kind of presents very similarly to influenza, and that's kind of the challenge because at this time it could just be like any upper respiratory tract infection. The timely diagnosis is kind of really important here to decrease the spread of the infection.
Yeah. I've noticed or read that the influenza often hits people suddenly like a truck. They've got the muscle aches, they got the fatigue and the fevers and the cough, everything all at once. And it kind of sounds like the COVID-19 starts a little more slowly and it's a little more mild at first. And then it's sometimes that second week of the illness where it becomes more severe. Is that what you're seeing too, Jawad?
Yeah, I think you're kind of right. And it seems that may be one of the factors, which is leading to the rapid spread of this infection because many times, people may think it's a mild infection, just subtle symptoms, not serious. It may be, young patients who are getting infected, but I think what we are learning from some of the studies is that even the younger patients with like milder symptoms, they can actually spread the infection. So they could be the drivers of the spread. So I think it's very important not only to consider that the elderly or, patients with chronic medical conditions are at risk, they get the severe form of the disease, as Dr. Evans mentioned, like the acute respiratory distress syndrome, respiratory failure. But I think everybody, can get infected and with even subtle symptoms, which kind of, get worse after a few days or may not get worse, or may stay very mild. But I think it's very important to recognize that those individuals, even if they don't have chronic conditions, even if they are young, they may spread infection to more susceptible population like elderly patients, or people with chronic medical conditions. So that I think is really concerning. That's why I think the emphasis is on social distancing at this point, that it's everyone's responsibility, whether you have symptoms or no symptoms, to take precautions like hand washing, things like that. Yeah.
We brought up social distancing. Kelly,
did anyone know what social distancing was 2 weeks ago? And we've said it hundreds of times probably in the last week as this has become more real and more local and regional for us. And really, this is a commentary on, I think a lot of younger and healthier people, as they saw news coming in, as this began to spread in the United States, well, I'm unlikely to get severe disease. I'm not that worried about it. But the point really is that specific to this particular virus, our concern is that people probably spread the virus with either no symptoms or very mild symptoms. So the importance of people who feel fine to participate in social distancing, we just cannot emphasize enough that as little contact and as few person-to-person contacts as you can make, that can decrease the rate that this disease spreads for us.
A woman from Falkton asks, how long do they predict this will last, Jawad?
Well, I think it's a very unclear, foggy situation right now, and I think it's very hard to predict. But I think what we should learn is from the trend over the last few weeks in USA. Now we are seeing doubling of the cases in a very rapid fashion. So it's very hard to predict, but I think next several months, we may see a peak. And I think, this is a very tough situation. Now, the issue is that some of the things with this virus, sometimes I hear people saying it's just a virus, but it's not like any other respiratory virus in the context of two important, findings. One is that it's very rapidly transmissible, and it can infect a lot of people. But there's something in kind of medical terminology called R0 factor, which kind of states like if someone gets infected, how many more people that person can infect. It seems that from the studies that R0 factor with this virus is about almost 2 or 3 people. So one person can actually infect 3 more people. So if you have the spread in a community, it may take some time from getting one case up to 10 or 20. But once you start having more cases, it takes a very short time to double from 100 to 200 and to 500 to 1,000. And that's where we see what we describe as the hitting the exponential curve, like you see a sharp rise in the number of cases. And that's why I think, considering, the R0 factor, transmissibility, and the exponential curve issues, I think the concept is to kind of flatten the curve, by social distancing, that exactly what Dr. Evans just explained. Yeah.
For Dr. Nazir here, does this COVID virus have a natural host? Has it mutated from an animal to be able to enter the human host?
That has been, kind of a theory initially, from when the case was first, when this disease was first recognized in Wuhan city in Hubei province. I think there was some link to the animal markets, and I think, it has not been definitively proven yet, like what the secondary host is. But I think what is concerning now is that there is person-to-person spread. So at this point, you don't need a, intermediary host to spread. I think it's spreading very quickly from person to person.
I think I'd like to go to an animation that we have that shows. Okay, we're going to do that animation a little later here yet. Multiple people have asked, once people recover from coronavirus, are they still susceptible to catch it again, or do you build an immunity to it?
I mean, part of the challenge with answering questions about this is there's so much we don't know still. It's very early. This is the first outbreak of this particular virus. We don't know if it's going to have capability of doing things like influenza does in a seasonal fashion, or if it will be a more stable virus that, a single immunization or a single infection might immunize people to. We probably won't know that for a while. And I think I've seen some case reports of possibly people getting infected a second time, but I don't know how well studied that has been.
I kind of agree with Dr. Evans on that. We still have to learn a lot about this virus. Even when we say the incubation period is 2 to 14 days, that can be a little longer, in patients who are immunosuppressed, or who have chronic medical conditions. So, that's not an absolute number. So the viral shedding can be, for a prolonged period of time, in certain patient population. Also, I think this question, if you build immunity and you get reinfected or not, I think you have to kind of balance that in the context of relapse too. Some patients, get better and then infection may relapse, So we have seen some cases where the test was negative and then they got sick again and they were positive. So again, I think we are learning about this disease.
Yeah, I'd like to highlight that the incubation period, so the period from when you first get infected from someone coughing nearby, and then till when you start to have symptoms, like you said, maybe just 2 days, maybe 2 weeks. Mm-hmm. And whereas a cold or a flu, it's usually 1 or 2 or 3 days. Mm-hmm. And so that's where this can really get drawn out and could really easily spread when people don't have symptoms yet.
Right.
Yeah. Earlier this week, COVID-19 testing was halted in South Dakota due to a shortage of supplies. Today, on-call co-producer Ginger Thompson did a video interview with the state epidemiologist, Dr. Joshua Clayton, to find out if new supplies have arrived and for an update on the virus.
Dr. Clayton, thank you so much for joining us. I know your office is swamped, so we'll keep this brief, but first, can you give us an update on the coronavirus in South Dakota?
Certainly. So we have 11 cases currently in South Dakota. Unfortunately, we have had one individual who has died from coronavirus infection. We have tested over 500 individuals, and we continue to offer testing at the State Public Health Laboratory, mainly for those who are individuals who are hospitalized, those who are healthcare workers, and others that might be living in institutional settings such as long-term care facilities and assisted living centers that are at greater risk.
So you mentioned that you have tested about 500 people. Is that correct? Now then, I understand earlier this week, then testing kits ran out. What is the current situation on that?
So we do have some additional kits that have been received at this point. So we are up and running with some additional testing. We have always had a prioritization schema on our website, which is focused on individuals who are at higher risk of either serious infection or of potentially transmitting COVID-19 infections to patients. And so we have been able to resume testing for those higher risk individuals in those high-risk populations.
Can you tell us a little bit about who is then higher risk and what some of those diseases are?
Certainly. So the information that we have is coming out of China and some of the earlier cases that we do have in the United States. So those individuals are older Americans, so 65 years of age and older, individuals with pre-existing medical conditions, and that primarily focuses on those with lung disease, heart disease, diabetes, and immune suppression.
Is there any suspicion of community spread in the area?
So of all of our 11 cases, what we do know is that all of those individuals did have a travel history outside South Dakota during their 14-day incubation period for the virus. So that would have been the time from when they were first potentially infected to when they started to show symptoms. And so for those individuals, we can say that travel was likely a contributor to their infection. At this time, we have not identified a person to have been infected who has not had a travel history. We are on the lookout for that. That is a key component to our investigation. And so we continue to ask any patient who does test positive for COVID-19 about their history in the past 14 days to help guide whether or not we do have community transmission.
Is there a suspicion that the load is actually higher than can be documented right now?
I think one of the key messages coming from the Centers for Disease Control and Prevention is that we anticipate that there are some cases that have much milder symptoms than the individuals that we have tested, and so that our number of cases that we have identified is likely an underrepresentation of the true burden within some of our communities. But there again, South Dakota is one of the states that has had a much wider sort of focus on identification of COVID-19 infections based on the clinical criterion that we had set forth and that providers in the community were using. And so I feel that we have been able to identify a large number of those individuals. At least there was the opportunity for us to do so. But it is important that testing is transitioning, that we know that 80% of individuals who become infected with COVID-19 will not have a severe infection. They'll have mild upper respiratory, moderate. So, potentially a fever, cough, maybe a little bit of shortness of breath, and some other symptoms that we typically see with respiratory disease.
So speaking of that, typically we show flu numbers, and that has been the biggest concern that we've had over this season. And we still have, the flu cases in South Dakota were over 14,000 so far this season. Is that right? So how much of a risk is flu still, and how does the flu in severity compare with COVID-19?
So influenza still is a risk in the community. This is still the time of year when we have reached our peak for influenza activity. So we are seeing decreased activity overall. But the influenza and other respiratory pathogens typically circulate this time of year. So it is important that clinicians are concerned and first identifying influenza in patients that they suspect may have COVID-19 infection. It is important both for the clinical identification of those cases, as well as just to note that individuals do die from influenza each year. Our COVID-19 case fatality rate is about 10 times higher than it is for our seasonal influenza. So it is something to keep in mind as we have individuals who are either severely ill due to influenza or becoming severely ill due to COVID-19. That we do anticipate that we will have additional cases in South Dakota, we'll have additional hospitalizations, and unfortunately we will have additional deaths.
Great. Thank you very much, Dr. Clayton.
Thank you so much.
If you have questions about the coronavirus, call us at 1-888-376-6225 or send an email to ask@prairiedoc.org. And even though that clip there was filmed from earlier today, there's always new information every hour with this virus, and we are at 14 cases in the state now. We've talked about social distancing. We've talked about, we want to flatten the curve. And I'd like to bring up an animation here from the Washington Post. It was really helpful that they shared this with us. And the graph on the left, where it's kind of a free-for-all, everyone's still mixing around, you can see where the virus spreads very quickly. And pretty soon, 100% of the dots have been infected. And then it dies down once again since everyone's had it. The graph on the right, the animation on the right, where people are practicing extensive distancing, a lot of the dots are at standstill. Now you can't keep them all standstill, so the dots are bouncing around and infecting some, but not nearly as many. And so that is why we want to flatten the curve and allow this to protect people and keep from having everyone infected at once. And Kelly, why would we want to avoid everyone being infected at once? Because it would be done sooner.
Fair point. I mean, this is just a reality that we're not faced with in the United States of America very often, but our resources are in fact finite. We do not have infinite resources to take care of that many sick people at a single point in time. nationally or locally. And so I think there's some statistical models that said if we didn't do any social distancing, it's possible that over a short course of time, probably a period of months, up to 80% of the entire population would be affected or infected by this virus. And I mean, if that were the case, of course, a large percentage of those would have mild symptoms and not require medical treatment. But even that small percentage that would require hospitalization, ICU status, and at worst case ventilator support exceeds far more than what we would have the capability to help those people. So that's why it's important to this flatten the curve. And if anyone's logged into any social media or even read the lay media, they're seeing those words and taglines.
Since we don't have the available testing in South Dakota, shouldn't everyone that has the symptoms maybe assume they have it and follow the guidelines and self-quarantine? Any thoughts on that, Jawad?
So I think that's a great question, and I think we have to also see what's happening in some of the other countries, looking at Europe, and even like UK. I think if we don't have testing, then we have to prioritize testing. And the patients who are most at risk, are hospitalized patients, because you can imagine one hospitalized patient can infect 3 more, including healthcare workers, and what impact that can have, on our healthcare system, and the capacity. So we have to prioritize testing to hospitalized patients, our healthcare workers, or patients who have very high risk conditions. But in UK and many countries, when they are faced with difficulty testing, they have gone to non-test strategies or prioritized testing. So they have pretty much said, if you outpatient, if you are sick, just stay at home for 7 days. If you are sick, just stay home, because we cannot test everybody in the community. We have to prioritize. So I think that's a very important message. If you have any symptoms like fever, cough, or shortness of breath, and they are mild symptoms, and you don't have chronic conditions, you just need to stay home. But if you are elderly with chronic condition, you can still stay home, but call your provider, to determine next steps for your assessment.
And the CDC recommends really that sticking with that quarantine if you're sick, at least until you've had the symptoms for a week and they're improving, and you're fever-free for 72 hours without Tylenol, ibuprofen. Mm-hmm.
Exactly.
But if you have been in contact with someone who's had coronavirus or suspected of it, because of that long incubation period, that's why you might need to quarantine for 2 weeks. Mm-hmm. And then once you have symptoms, then maybe for at least a week.
Right. It's a lot to ask of people, and I don't think, none of us take that lightly. We realize the huge impact this is having on every facet of society, but we really think it's important.
Yeah.
Mm-hmm.
And Andrew, I think I would also mention one more factor that we also have to consider, that there are about 49 million people in US above the age of 65. So if you have a rapidly transmissible virus, and a high number of susceptible population, I think the people who are young and mildly symptomatic, I think they have to think how they care about their elderlies and, family members. I think this kind of caring, and it requires a change in lifestyle, at least temporarily. It's a social responsibility.
Mm-hmm.
We appreciate everyone's questions, and so I think we're going to try to cover a bunch of these here now.
Okay, let's do it.
I was tested positive for influenza A, and doctors told me I cannot get both the flu and COVID at the same time. Is that true? Does it make it easier for me to go get COVID if I just had the flu?
So I would say I would probably clarify what this patient may have heard. So in a lot of clinics, because of resources, if someone has symptoms which could be influenza or COVID, we have tested for influenza first, because those resources are less limited, and that's still a more likely cause of disease at this point in time and where we live. And so it would be statistically very, very unlikely to have both the influenza and the COVID virus. It wouldn't be impossible.
Certainly
it's physiologically possible. We just think that statistically it'd be very unlikely for you to have those at the same time. I don't know if we know the answer to the second question.
Yeah, if your immune system down is from having the flu,
Mm-hmm.
is down from having the flu, I suppose, yeah, maybe you're more susceptible. But there's so many things we don't know since it's a new virus. A caller over 65 had a pneumonia shot. Would this help them if they get the virus?
I don't
No.
think so.
Yeah, unfortunately. A woman from Sioux Falls asked if you're exposed, how long does it take to come down with symptoms?
Yeah, so that was the incubation period that we were talking about. It could be as short as a 3 to 4 day time, but we think it could be as long as 2 weeks.
If you can get the virus again, would the second infection be as extreme as the first infection? I think here we should point out that we would hope and we assume that people can build an immunity from this, from having it, but we just don't know the facts on that. Jawad, I don't know if you know any specifics.
No,
on that.
I kind of agree with your response. We just don't know about this.
Yeah.
We might know in a year, but we couldn't say for sure now.
How long can the virus survive on hard surfaces? Jawad, I don't know if you have insight into that.
Yeah, I think there has been some recent, publications on that. I think, it could be up to 1 to 3 days, depending on what kind of surface it is. If it's plastic, or steel, or cardboard, 1 day for cardboard, steel, and, other stuff, could be up to 3 days. So that's one of the things. That's why we advise not to touch surfaces. And if you have a household plan, that should include, disinfecting, commonly touched surfaces like the doorknobs and, anything which you use more frequently touched, So I think, it can survive on surfaces for a couple of days. That's why I think it's very important, to wash your hands, use hand sanitizers, but also to disinfect the commonly touched surfaces at your workplace, or at your residence.
I think that's a great time to pull up a graphic about the ways you can protect yourself. And so these include washing your hands for at least 20 seconds with warm water and soap. Singing the happy birthday song twice. What are some of the other things you can do, Kelly?
So really avoiding close contact, and so we've heard from the CDC 6 feet away from people. That probably means avoiding being in a place with more than any amount of people that you can avoid being around. That will help that close contact problem. So not gathering in large groups. Go ahead.
Using hand sanitizer.
Hand sanitizer is a fine alternative.
60% alcohol content. Wiping
your
the surfaces
down.
with Lysol or what other cleaner. There we go. We've got stay home if you're sick. We can't emphasize that enough. Since we can't test everyone if you're sick, please just stay home. Unless you really need help, and call ahead to the clinic or hospital first to hear what they want you to do. The face masks. What do you recommend about face masks?
I think if you can stay home and isolate like you're supposed to, the need for a face mask for the typical patient is low. And we also are talking a lot in larger circles about that could be something that's a limitation for healthcare workers. So you read stories about ERs that have had boxes and boxes of face masks stolen, which is heartbreaking because we will need that equipment if there is a surge in this to keep our healthcare workers safe. As soon as healthcare workers start getting sick from this, then our limited resources are even more limited. Yeah. So
the masks help more to help contain the virus when someone's sick from them wearing it, but protecting you, unless you've been fitted perfectly with a good mask, we don't know how much protection it really offers you. Is it safe to attend outdoor events like meeting friends to walk in a park or going to an outdoor auction?
I would say outdoors are probably a safer bet. I think you would still want to make the group small and try to maintain that space between each other. I think something like an auction could still stand to put a lot of people close together. That would be something that I would avoid. Yeah, in the news they talked about joggers in San Francisco. Yeah, there's so many people jogging around. But if you're jogging around your town in South Dakota, you're probably okay. Like many of the kids who are staying home from school, my 6-year-old daughter is curious about just what this hoopla is all about. She had a question that gets us back to the basics about viruses.
Hi, my name is Lydia, and I want to know how germs make babies.
So one of the things about viruses that makes them quite unique is that they're totally dependent on cells to reproduce. So they've got to be able to actually get into the cell. So part of the whole strategy that we're looking at in terms of why we're washing our hands and all those things is that they can't replicate on their own. They've got to have the host, and we are the host. And so then the virus has to get in. And we've got lots of defenses in our body to help against that. So it's things like mucus and sneezing and those kind of things help limit the ability of viruses to actually to cross over. And then once they do, then what they have to do is they sort of have to hijack the cell's own mechanism, because they themselves just contain RNA in this case, and then they use their RNA to hijack the cell to actually then replicate themselves. So they're totally dependent on living cells. And so that's what makes them, in some ways, actually easier to handle than, let's say, things like bacteria. So think of salmonella and things associated with food poisoning. They can grow outside the body and live, but these can't. So our ability then to limit their ability to get into our body is really important. And then again, their ability to hijack the cell is dependent on them being able to actually infect the person. We're infected with lots of viruses continually, and 99.9% of the time, our immune system is handling that. And the one thing that I think that one of the best things that people can do, and we've known this from lots of work that we've done looking at respiratory disease in animals, is that just stay hydrated. Just keep your water consumption up, because that's important to keep the what we call the mucociliary apparatus, the thing that clears our lung and our trachea, helps keep it clear and cleaned out. As long as we're hydrated, that's good. And then for the immune cells to get around, they've got to be able to move from point A to point B. And again, being properly hydrated is going to make sure that happens as well. So if I was going to give one simple thing that people should do, is keep themselves well hydrated.
Yeah, she asked me that word for word the other day, and I was like, that's got to be on the show.
I mean, adorable.
So an email asks, why is there no cautions about using various forms of cash? We are only using credit card where we're the only ones that touch them. So what do you recommend on cash?
I don't know that I've seen anything about the virus being able to live on paper. Jawad, have you seen anything about that?
I have not heard anything so far, but as we say, we are learning about it, so I don't know if things changes tomorrow.
Yeah,
right.
Well, but we do know. I know that germs in general can be on money, so
yeah.
It is something that is
thought.
something to consider.
Mm-hmm.
I think it may be, Andrew, it may be important just to make sure we wash our hands very frequently and avoid handshakes. I think that's also important to tell people to learn to avoid handshakes.
Yeah. A female from Brookings asks, in regard to social distancing, my concern is with my teenagers who think going to friends' houses is still safe. Can you clarify if play dates and visits to other people's homes is okay, or is part of social distancing?
I would say it's part of social distancing. I know it's hard, but I really do think that the less that we can intermingle and mix, the more impact we can have on that flow chart of dots that we just showed. And I know it's hard to coop a teenager up for this long, but I think that if you can, we should keep our kids at home.
A question here, I have two family members who take Celebrex. I've heard that NSAIDs exacerbate the pneumonia part of COVID-19. Should my family members try to go without Celebrex now or stop if they were to feel ill with COVID-19 symptoms? Jawad, would you touch on that?
Yeah, I think I think there may be some comment about it, but I've not heard any recommendations, to make that recommendation yet,
Yeah, I think the verdict is still out. There was something that got spread all over the lay media about this that I think was erroneous. The WHO has not made a recommendation against NSAIDs officially. So I would say if you are someone who relies on this for a valid reason, there's not a reason to change that we know of at this point.
And ibuprofen would be a big part of that family.
CDC has not made any recommendation also.
Yeah.
If a person has a coronavirus, would they automatically have a fever? Is taking temperature a valid way to detect if someone has it?
No, you might not have any fever. You might not have a single symptom. So it would be possible to have just the cough and no fever. It would be possible to have even milder symptoms than that. So, and like we've said, even in people who do have a fever, it's very possible that you could spread the virus days and days before a fever would occur.
Yeah. Is the virus able to be spread through packages delivered to your house through the mail? Jawad?
I don't. I have not heard anything that's happening. I was on the CDC website just before the interview, and I didn't see anything like that. Yeah.
Yeah. Any concern with the home health care workers being around individuals who have air traveled around the U.S. lately, caring for their clients?
I would say I think home health companies have probably put in processes that they're telephoning patients and screening for those risk factors or symptoms before they arrive so that they could wear protective equipment if they do need to make those visits.
You know, in general, Kelly, would we recommend that patients come to the clinic for regular medical care or not?
I think it's really in flux right now. I have a lot of patients, I see an older population of patients who are a little bit, nervous and scared about coming to the clinic, which is understandable. I've advised those people that I think it's fine for routine care if you want to delay that by a month or two. If they don't have a complaint, that's okay at this point in time. We're also seeing, so I did our clinic's very first virtual visit on Wednesday. So I think the clinics that have those abilities will be ramping up ability to try and do some visits via telephone and virtual methods.
An emailer asks, is it misleading for South Dakota government to say there is no community spread when they are only testing those with a history of travel? Jawad, any thoughts on that?
So that's a real tough question. I think that they probably don't have any confirmation, from the review of cases they have. And I think some of their data is limited due to, limited testing. So I think they cannot prove it at this point, But I think as we are getting more testing results available and they will review more cases, I think they probably will be able to give, a more definitive answer. I would say at this point, we don't know. But if you look at what's happening in our neighboring states, like Minnesota, Iowa, Nebraska, all of those states, now have community spread. So either, I think, we cannot say officially because we don't have a proof, but I think it may be okay to presume that there is community spread.
Better safe than sorry. Otherwise, we'll have it guaranteed either way.
We probably should say that there is possibly community spread.
Yeah.
We will know more once we have more data available with the diagnostic testing results.
Mm-hmm.
A woman from Minnesota asks, I am someone who is currently on hydroxychloroquine or Plaquenil for arthritis, and today they have been saying on the news they are using that to treat the symptoms of COVID-19. Does that make me less susceptible to get it?
So we do not have proof of that question. I would say, I've seen 2 publications about this particular question, and hydroxychloroquine, I think in conjunction with azithromycin, a commonly used antibiotic. The problem right now is that we do not have the ability to do good studies, and that's for several reasons. It takes time to do good studies, and so really anything that you're seeing come out hot like this is I would take that with a very measured approach. I don't think we could say, we can't draw any conclusions based on the studies she's referring to.
Yeah, they're looking at HIV medications. There's a long list of medications that we hope could be helpful, and so we're trying to do some studies on it, but
it's going to be a long time before we know the answers to those questions. And my biggest concern is that when these things come out in the media, that someone like her who takes hydroxychloroquine for a chronic disease, suddenly there could be a shortage of hydroxychloroquine if people interpret this the wrong way.
Yeah.
Yeah,
Jawad,
I kind of agree with you, and I would also state, that if you review the literature, what was working last week is not working this week. So I think it's just too much of information which is not really, confirmed yet. I think there are many clinical trials going on, and I think it's a matter of learning more, about these interventions. But I do worry about, sometimes Kaletra for our HIV patients, it's kind of, some patients are on Kaletra and the hydroxychloroquine, So I think these kind of, assumptions can lead to deficiency of those medications for patients who need them.
When I go home from work, and go to work for that matter, there's one place that's full of cars, and that's the grocery store. If we go to the grocery stores, how safe is the packaging and food we buy? Should we be concerned with the sacks we bring home from the grocery store?
You know what? I sympathize with this person because I went to the grocery store on Sunday and never have I been more aware of my surroundings than that, just thinking about all the things that you're touching and you're used to touching. Again, I think we don't know. We are having more concern that it may live on inanimate surfaces. But I think the bottom line is use the hand sanitizer when you see it. Wash your hands when you get home. Try to keep your hands away from your face and mouth and eyes in that situation. And I think there are things that we have to do. We have to get groceries, but be as safe as you can.
I might add that there aren't all of a sudden more people.
Right.
We don't have more demand for toilet paper or milk or anything else. And so if everyone can pretty much use what they normally use in the same quantity, we're not going to run out of anything unless people start hoarding.
Right.
Now, and if you can limit your trips to the grocery store, maybe grab a couple more things so you don't have to go as often.
Right.
But I don't know if there's a specific reason why we would need to have everyone in the grocery store all the time, especially when we're trying to eliminate the mixing and mingling of people. What is wrong with wearing masks to protect you from COVID if you aren't diagnosed and don't have symptoms to protect yourself? Fair question. Jawad?
So I think, the mask, basically protects you from the, droplets of a person who's infected, because those can remain suspended, in the air. And if you are in close contact, you can get infection. But if you are asymptomatic, wearing a mask, does not help you in any way. If you are practicing social distancing, 6 feet away, away from the sick people. So I think that probably, is not going to help protect you. In fact, it will lead to deficiency of the masks, which we desperately need, for places like hospitals for use.
That's right. If we can have most people stay at home and they don't need a mask then if you're mostly staying at home. Whereas if we run out of masks pretty soon, now all our healthcare workers are sick and can't take care of anyone, and so that could be a big problem. An emailer asks, I have an upper GI appointment to determine why I feel full quickly when eating. Should I do the procedure or put it off until the virus is gone? I currently don't have any pain, am not losing weight. I am immune compromised. So once again, that question of should we put off medical care?
Should we put off elective procedures? So there are a lot of places that are actually proactively canceling things like this, so elective procedures. I think this is something that may change depending on where you live and what facility you're using over the next couple of weeks. But it's not an unreasonable thing to consider that either from the patient standpoint or from the facility standpoint that may be something that we can put off till another time.
I know facilities are looking at protocols for this and deciding, and I think they're also waiting to see if there's community spread. Once that, they'll for sure, I'm sure, cancel them. For now, a lot of places haven't canceled them in South Dakota, but it's a consideration, especially if you're immune compromised. Yep. We want to do quick answers here so we can get to a lot of these others. Right. Are there any nutritional products that will help lessen the severity? Also, does drinking more water help, or will it hurt things? I might add that water helps your immune system in general, so it's good to stay hydrated.
Water is just a great thing, drinking water is just, you don't get dehydrated. That's great, I'm not sure of any nutritional products, which have been proven, to help, prevent this infection, But again, I think this is something we're going to learn more with time, but I have not heard anything which is very definitive, proven scientifically to help.
Jawad, this person asked, do they use oxygen tents for COVID patients?
Oxygen tents, I have not heard any relation with that too.
I guess what are they doing in places where there is a confirmed COVID patient that is sick and in the hospital? What are they doing in the hospital for those patients?
Great. So I think that's a good question. I think because it's a droplet mode of transmission, if there is a known or suspected patient of COVID, we would, immediately isolate that patient in a room, door closed, and I think we advise wearing the masks, Per CDC guidelines, there are different types of, masks, including PAPRs, N95, face masks, So I think, depending on what's available they're all efficient, and also some patients may require procedures, so they may require a different type of the mask, if they're not requiring any procedures. I think we are very concerned about conservation of the PPE for future. Yeah.
If you do have COVID-19, what treatments can you do at home? And then they ask about ibuprofen. Is it dangerous? We did cover that. Tylenol, and they asked about Tylenol. Tylenol is okay. Is there any treatments we can do at home?
I think the typical things, Tylenol, again, we don't have confirmation that ibuprofen or NSAIDs are more dangerous. So those typical symptomatic things, fluid and rest, and isolation. I mean, really the big emphasis here is on trying not to spread the disease to several other people while you're sick.
One person asks, it sounds as if there's shedding before obvious symptoms show in some patients. How about patients who remain basically asymptomatic throughout the time the virus was present? It would be frightening to think about those individuals who run through an infection, shedding virus throughout, and are never detected. And I guess that just brings home the point.
Yes, absolutely.
And that's why we're here doing this show, to drive home the point that all these events are canceled for a reason. We want social distancing for a reason, to avoid the spread of this infection, because you might have it without knowing it. And even if you are having mild symptoms, that doesn't mean the other person's going to have mild symptoms.
Right.
So we need to protect everyone. We've got 1 minute left here. A person on Facebook asks, I have asthma and I would appreciate any information for someone like me.
There is some data out there that probably, if you have the choice between using a nebulizer and an inhaler in asthmatic patients with the disease, we'd prefer an inhaler because we don't want aerosolization to happen. But other than that, certainly asthma would be something that would increase your risk compared to the same group of people without asthma.
And if you are someone that's older or on a chronic medical condition or immune compromised, if you need groceries, you could order them online.
Right.
You could call someone else to pick them up. You can do things to help protect themselves. We'll be right back after this.
We feel privileged to have had the honor of creating a legacy of service through the Prairie Doc organization.
It has been our desire and goal to share health information that is not influenced by marketing or sales, but rather is based on science.
We started in the 80s with a newspaper article and expanded in the 90s with a radio show. In 2003, we started a TV program, and in 2010, we added our social media platforms.
This has been a team effort made possible by many volunteer physicians and experts serving as hosts and guests. All of them are Prairie Docs.
Thanks to them, we've been given the ability to pass the torch so that this legacy may continue beyond my time on this earth.
Please join me in embracing our team of Prairie Doc physicians, each committed to this mission. Family physician Andrew Ellsworth, Deb Johnston, and Jill Cruz, along with internist Kelly Evans, all from Brookings, South Dakota.
These volunteer physicians, and many others, have in the past and will in the future serve as authors of Prairie Doc newspaper columns, host of our TV and radio programs. Thank you.
With the coronavirus causing school to be canceled, my son brought his schoolwork home. He shared with us a Greek mythology worksheet about Pandora's box. If you aren't familiar, the Greek god Zeus gave a wedding present to beautiful Pandora, but instructed her not to open it. Like many of us, impatience and curiosity got the best of her, and she opened it anyway, which caused a lot of new problems. Similarly, with COVID-19, this new virus is already out of the box. This is a global pandemic, and we are being asked to be patient and conform to social distancing to help slow down the spread. This is our current challenge. Every day we hear about sporting events, concerts, schools, and travel plans being canceled. This is the best known method to slow the spread of COVID-19. The less we are mixing and mingling, the less the virus is spreading. When we slow the spread, we give our healthcare systems the best chance at having the resources on hand to keep up with the number of people who need help at any given time. In areas of the world where cases of COVID-19 were allowed to spike, the healthcare systems are overwhelmed. Some hospitals don't have enough beds, enough ventilators, enough medicine to treat everyone that needs help. They don't have enough masks and gowns to protect their staff. In these situations, doctors are having to decide who gets treatment and who doesn't. Thankfully, of those who become infected, possibly 80% will only have mild symptoms. Some may not have symptoms at all. However, we need to understand that some will become very sick and some will die. Unlike influenza, COVID-19 is a new virus. Therefore, none of us have the immunity from the past or from immunizations. There is no herd immunity. That is why events are canceled. That is why social distancing is urged. Since most people will only have mild symptoms and some people may not have symptoms at all, the virus can be spread easily without us realizing it. We all need to be patient and follow the instructions from health officials. By doing so, we can hopefully prevent a large spike of a lot of sick people at once and avoid a worst-case scenario. My son's main impression from his school lesson was that despite the sickness and problems that were released, Pandora closed the lid and held hope inside the box. I have hope that together we will contain this virus, and in the end, this too shall pass. A big thank you to our guests, Dr. Jawad Nazir and Dr. Kelly Evans, for joining us tonight. We would also like to thank everyone who helped create this program on unusually short notice. All of the Prairie Docs, the production crew, the phone volunteers, the SDSU School of Communication and Journalism, the South Dakota Department of Health, South Dakota Public Broadcasting, the South Dakota Board of Regents, and South Dakota State University for allowing us back on campus to get this important information to all of you at home. Please stay tuned to South Dakota Public Television for more on the COVID-19 outbreak. Directly following us at 8 p.m. Central Time is South Dakota Focus. Host Stephanie Rissler gathers a panel of experts to discuss the spread of coronavirus and how it is affecting the state, from strains in the healthcare field to the economic impact. Then at 9 p.m., Confronting Coronavirus, a PBS NewsHour special hosted by Judy Woodruff. The program will include interviews with officials, reporting from NewsHour special correspondents throughout the world, and a virtual town hall with curated questions from people across America. That does it for tonight. From all of us here at On Call with the Prairie Doc, remember to wash your hands, and until next time, stay healthy out there, people.
The physical tolls of injury or aging are obvious, but what is the impact of Parkinson's or other dementia-type afflictions when our brain starts to fail? Next time, On Call with the Prairie Doc.
Useful, scientific-based medical information delivered in a respectful and compassionate manner. This is what we get from the Prairie Docs. I am proud to serve on the board of the Healing Words Foundation. Our nonprofit organization works behind the scenes building financial support to continue and expand Prairie Doc programs. We thank the many health providers who volunteer their time to answer our health questions. Significant funding is required to produce and distribute video, radio, and print throughout the region. Your donations will help the foundation continue to offer free and easy access to the entire library of Prairie Doc health education programs. I grew up with Rick Holm on the prairies in DeSmet. On behalf of the Healing Words Foundation,
and on behalf of a lifelong friend,
we invite you to join our mission. Go to prairiedoc.org and click the donate button today. Thank you.
Major funding for On Call with the Prairie Doc has been provided by
Avera is a proud sponsor of On Call with the Prairie Doc on South Dakota Public Broadcasting. Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information.
And with the ongoing support of these individuals and institutions,
South Dakota Foundation for Medical Care,
Brookings Health System,
Ophthalmology Limited,
Avera Heart Hospital,
Dakota Allergy and Asthma,
Fishback Financial Corporation,
Vance Thompson Vision,
Urology Specialists,
Brown Clinic,
American Academy of Family Physicians Foundation and South Dakota Academy of Family Physicians,
Black Hills Medical Society,
Aberdeen District Medical Society,
Flandreau Madison Brookings District Medical Society,
Sioux Falls District Medical Society,
Yankton District Medical Society,
Dakota Bank,
Orthopedic Institute,
Physicians Care Sanford Clinic Community Service Committee,
Aberdeen Asthma and Allergy,
and Swiftel Communications.